Okay, we're going to go through a procedure for chronic heel pain, and the first thing we're going to do is map out the area of most discomfort here. And what I want you to do is you tell me when I'm on that spot, okay?
Somewhat bigger. Somewhat bigger. Not that area. Somewhat, yeah.
Okay. So right in there seems to be the most painful area. So we're going to mark that. And so now what we're going to do is raise a small wheel of anesthetic under the skin, right in our area of pain. So what I'm going to do is spray your foot with that cold spray, okay? Just a little pinch. We'll go away fairly rapidly. Actually, you won't feel much after this. Okay. That's it. So now what I do is take a Hibiclens or betadine stick and prep the area while we let the anesthetic work. And I'm going to do just a quick scan with the ultrasound. So we see where we're at. Okay? So now what we want to do is insert our cannula in the through the anesthetic wheel while we look for the nerve. Okay, so what we're going to do is we're going to look for your area of heel pain. So I don't want you to watch because sometimes that will skew the results, and when we find the area where it's like, yep, that's my heel pain, it may not be as strong as what you normally feel. I'm just looking for the area, okay? You feel that? Okay.
Yes, yes, yes.
Okay. That's pain in your heel?
Yes.
Okay, you feel that right there. Okay?
I've been away a little bit actually.
Okay. So it's gone down some.
Yes.
Okay. So at this point what we're going to do is we're going to check and make sure we're there. So like I said, I'm not trying to make you jump out of the chair here. So we just want to, we're going to look for the little nerve branch. And what we're going to do is, you still feel it?
A little bit.
Okay. So we're going to do a sensory stimulation first to make sure we're on the nerve branch. Now what I want you to do is tell me if it increases any. Okay? About the same as it was? We go from 0 to 0.5 volts. Okay? About the same as it was. Okay, back down. Okay.
Oh,
Right there. That's the spot?
Mm-hmm.
Okay. Still. Okay. So that started to intensify. Okay, back down. So that's going to be the spot because she could feel that increasing at 0.29.
yes.
Okay. So now what we're going to do is check for a motor. Now you shouldn't feel this. This is a motor sensation, so we want to make sure we're not on a nerve that controls muscle movement. So it shouldn't be, you might feel a little vibration, but it shouldn't be a pain. Okay?
A little tingle in my
Okay.
toes.
Okay. So now we push on the select motor. And so now we go up to 1.25 volts on the motor stimulus. And we look for any fasciculation, muscle contraction in the arch, in the toes. So we're at 1.25 and we don't see any muscle fasciculation or contraction. Okay? Okay, so what we're doing now is put it to sleep and you're going to be all done, okay? So this will be the last discomfort you feel, okay? I particularly use a combination of xylocaine for a quick anesthetic and follow that with Marcaine once it becomes anesthetized. And it'll sting just a little while it goes to sleep. So you've already got a little in there, so. When we initially put the nerve to sleep, I do like to infiltrate sort of slowly because you are close to a nerve, which causes some pain. So a slow introduction of anesthetic is much more comfortable for the patient. You feel that? A little bit? Okay.
I know I like now.
Okay. Did you feel that down to your toe?
What should I feel?
Not much at this point.
No.
Okay. So tell me if you feel it again, okay?
I just feel some little tingling in my toes.
Okay, that's
all.
that's good. This is Marcaine with epinephrine, and again, this provides a very long anesthetic effect after the xylocaine sets up. And you shouldn't feel much of this, so tell me if you do, okay? And once we've located the nerve, if you notice with my right hand, I've held the needle stationary and not moved it around because we want to be right there. Oh, okay. Okay, and I usually give it a few minutes to let the anesthetic set up. If you can give it 3 or 4 minutes, it'll really help in terms of patient comfort and good anesthesia. So is that starting to feel numb at this point?
Sort of.
Well, I saw you dropping these cards. Okay, so what we're going to do now, we have good anesthesia in the heel. We're going to perform our first lesion and at 90 degrees centigrade for 90 seconds. So we put the machine on lesion, 90 degrees, and we're going to slowly turn the temperature up. Now, sometimes people will feel like a warm sensation. Sometimes people will feel, you know, things that really they don't describe. If you do, that's fine. But if it gets uncomfortable, let us know and we can put it on standby. And then some people don't feel anything at all. So most people don't. So the temperature is ramping up to 90 degrees. And again, I have been careful not to move my needle. I still have it in position. And then we hit timer start and wait for 90 seconds. Okay, the first lesion is completed at 90 degrees. So now what we're going to do is move the needle about 1/2 centimeter in the posterior direction toward the heel to another branch of the nerve. And obviously the heel is anesthetized at this point, so you sort of have to use your best guess. I try to keep my needle at the same depth at about 1/2 centimeter in the longitudinal direction with the foot. And again, we lesion for